Thank you, Mr. Coleman. And we will move into the last presenter. I think last presenter will be online. Therefore, see.
Welcoming
Okay.
ladies and gentlemen and the audience to my presentation on menstrual hygiene practices among ordinary level girl students of schools in Killinochchi district, Sri Lanka, a cross-sectional study. I am Dr. Pakeerathan, Master of Public Health student at the Department of Public Health, Faculty of Medicine, University of Kelaniya, and currently attached to Department of Radiology, Teaching Hospital, Jack. My supervisor, Dr. K from the Department of Community and Family Medicine of Faculty of Medicine, University of Vietnam, Sri Lanka. So, objective of this study is to describe the menstrual hygiene practices and analyze them. What is the relationship with the socio-demographic characteristic among the ordinary levels girls in Killinochchi. What the methodology we have practiced here is we have designed the study design as a descriptive cross-sectional study on menstrual hygiene practice. The study period was around 4 to 5 months in Killinochchi district. Schools and students have been from the 82 schools and 2,200 students in total. Sample size we have calculated nearly 385 students with a using 0.05 margin of errors, 95% confidence intervals with a p-value is 0. Sampling method, which is multi-stage cluster sampling, where we have selected 20 random school. Data collection was the structured self-administered questionnaire because of the sensitive questions and the observation checklist by the data collector. The questionnaire reliability was really high. French ALBA is 0.927 and the data collectors were trained development officers from the zonal education department of the Killinochchi district with a minimal disturbance of during the data collection, avoiding disturb. Data analysis was using IBM SPSS statistic version 26.0 using descriptive statistic and high-score test for comparison. So ethical approval we have obtained from ethical review committee of the University of Kelaniya with a parental consent throughout the study. So the what we have obtained the result is nearly 75.9, nearly 295 of them are the Hindus, and important thing is the family income of the district is nearly 25,000 less than 25,000. It is equal nearly 73.5% of the total population. That means 283% of students are coming from the 25,000 earning capacities. So where they have used, you see the father's educations and the mother's educations level. Mostly they are from the O level and the advanced levels is nearly 75 in number. 175 is have completed the OL. When we go further on the practices, all the students uses sanitary pad, but only 35.1%, nearly less than half, 135 students change them frequently at school. So this is very important point why that is so much low. So access to toilets, 92% having access to the covered toilet at home, nearly 355% of students having that facility. And when we come to the menarche, average age of menarche is 15.3. So mean menarche is 20.97 in 7 years. So menstrual cycle average cycle is lasting 5 days, but most cycle is shorter than 28 days altogether. So comfort discussing menstrual hygiene and its practices, only 24.4%, nearly 94%, 94 people, students have felt comfortable discussing menstrual hygiene open. So the result of the water and toilet cleanness. So inadequate water facilities and poor toilet cleanness contribute to the infrequent changing of the pad. So that is why they don't go frequent changing of the disposal of absorbs. Nearly 33% used absorption in bins, while another nearly 33% equally burnt them. So access to clean water. 68% have access to clean water and sanitation, whereas 31.7% faces challenges mainly water availability and toilet. So school facilities, nearly 39.7% of schools do not have the clean functional toilets, whereas 58.8% lack sanitary napkins in display. So significant findings where we have used the high scale shows that significant association between the access to clean water and sanitation and menstrual hygiene, changing absorptions in schools and changing pads and disposal methods are significantly contribute. Finding highlight that need for better facilities and educational resources for menstrual hygiene. So from that, we come to the conclusion that influencing factors where menstrual hygiene practices are shaped by cultural, religious, and socio-economic factors. 92.2% of students have access to toilets at home, but privacy and sanitation concern persist. Whereas economic limitation, financial constraint impact access to menstrual hygiene products, with the sanitary pads being the preferred. Educational support, there's a need for better education on menstrual hygiene and usage of both sanitary pads and products. School infrastructures is very important, where insufficient water supply and the inadequate disposal facilities in schools highlight the gaps in menstrual hygiene management. Urgent improvement, the study stresses that needs for improved infrastructure and educational resources to support menstrual hygiene. What we recommend from this study is clean, well-maintained toilet and proper disposal systems are critical for improving the menstrual hygiene practice, which is supported by the study conducted by Killinochchi and all in 2020. Whereas access to water and hygiene, reliable access to clean water, soap and hand washing facilities is essential, along with the consistent maintenance. Comprehensive education, schools should introduce educational programs covering menstrual health, product use, and stigma reduction as recommended by UNICEF in 2020. We also recommend support for low-income families. Affordable menstrual products should be provided with NGOs, collaboration supporting accessibility for economically disadvantaged students. Inclusive facilities must cater to students with disabilities, ensuring all have access to appropriate resources. Curriculum integration. Menstrual hygiene education should be incorporated in the school curriculum with policies for regular inspection to ensure compliance and the continuous improvement, as recommended by FIAS and Viswas group in 2020. So this is the end of the presentation of our study. Thank you for